Welcome to the second half of this week's instructional video regarding Ama. Just a quick heads up, the images that we are about to discover are a little bit graphic. Now to answer the question, what is Ama? Ama is an accumulation of poisonous materials that are formed inside the body as a result of long-term improper digestion. In Ayurveda, Ama is considered the mother of all diseases. If Ama is present, so is disease. Here pictured is mucoid plaque being removed from the large intestine during a colonic. This is typically what Ama looks like, but it also comes out in the form of fascia or plaque of the arteries or stiffness in joints, but typically Ama is found in the large intestine. Ama is some pretty nasty stuff. This is what they sometimes see coming out of patients after things like panchakarma cleanses or colonics. These types of plaques will actually prevent nutrients from being absorbed into the large and small intestine, and therefore the body starts to become starved of nutrients, leading to chronic ailments. Now let's talk about the vicious cycle that creates Ama in our life. It all begins with lifestyle and diet. Prolonged aggravated kapha comes from eating foods that are incompatible with our prakriti and are causing vikriti. Poor meal timing, eating too many foods out of season, too many processed and preserved foods, eating and drinking too much sweet, sour, or salty tasting foods, not getting enough bitter, pungent, or astringent taste, eating foods that are too acidic and or heavy. All of these are lifestyle and diet factors that lead to the accumulation of Ama in the body. This then leads to psychological problems such as depression, lethargy, and reduced mental clarity. When we are depressed, lethargic, and have mental fogginess, then we begin to slow down, which leads to a more sedentary life, especially if you have a desk job. The depression then prevents us from getting proper exercise, which could lead to even more disabilities. More disabilities lead to more sedentary lifestyle, and the cycle continues. Then we also have to contend with social conditioning of withholding natural urges. According to Ayurveda, there are 13 natural urges. The urge to pass urine, eliminate feces, eliminate semen, pass gas, vomit, sneeze, belch, yawn, eat, drink water, shed tears or cry, sleep, and the urge for heavy or fast breathing caused by overexertion. Majority of these urges should not be suppressed except for the urge to eliminate semen and hunger. Controlling hunger and sexual urges are an important practice in many of the world's cultures and religions for good reason. Fasting from food is considered a spiritual practice in both Ayurveda and yoga. Voluntarily abstaining from food for prolonged periods of time is a form of controlling the mind, which is the purpose of yoga according to the Yoga Sutras. We'll get more into the topic of yoga at a later program, but for now, I just wanted to correlate how yoga and Ayurveda simultaneously work together to create a synergistic approach between mind, body, and spirit. Eventually, these factors lead us to unhygienic environments. Depression and sedentary lifestyle lead us down the path of things like not showering. Any moms in here go days without showering? I know I did when the kids were first born, because we become so caught up in taking care of baby and everybody else that we begin to forget about taking care of ourselves. Or if we work in an unsanitary job or our home is unsanitary, this will also cause Ama to accumulate. Not washing our hands, especially after a bowel movement, is considered unhygienic. Wouldn't want my server at a popular restaurant to not wash their hands and then come serve me food, so wash your hands. All of this eventually leads us right back around to the beginning of our cycle, starting this vicious cycle of events that keeps happening and keeps reoccurring. Here are some signs and symptoms of Ama. One of the easiest ways to tell what type of dosha imbalance we have is the morning Ama. The color and odor of the coating on our tongue when we wake up in the morning is a great indicator of how our digestion is doing. A yellow coating is too much pitta, greenish coating is too much vata, and a slimy coating is too much kapha. The goal is to have white. Every day the coating should be removed. This is why tongue scraping is so vital. A metal scraper is recommended, ideally copper, because it's alkalizing, antibacterial, and antimicrobial. It not only freshens breath, it also helps us to remove Ama and helps us to improve our taste buds. This coating is recommended to be removed first thing in the morning before we eat or drink anything. Otherwise, we will just re-ingest that coating. Pain and stiffness upon waking up in the morning is a big sign that ama is present. When pain is present upon wake up, it's usually thought to be normal, but according to Ayurveda, this may mean ama is not only present in the joints, but on a deeper level within the digestive system. When our digestion is off, it affects us on literally every level. The body can't heal properly if the blood circulation isn't working properly, and if blood flow is obstructed by ama, then pain will be more present in the morning. Now, post-injury or post-surgery, etc., yes, of course there's going to be some pain upon waking up. But as we heal, that pain should begin to dissipate naturally over time. If the pain continues, it means our basic immune system is compromised. Seek professional help. Foul-smelling stools and gas, as well as broken stools, are a big indicator of ama. Ama sometimes ferments in the bowels, which will cause the foul odors. This can be adjusted by decreasing pitta-aggravating foods that are sour, salty, and pungent tasting. Broken or sticky stools mean too much kapha, more bitter, pungent, and astringent taste. Constipation or excessive flatulence without smell is usually a sign of excessive vata. Increased sweet, sour, and salty tastes and decrease bitter, pungent, and astringent taste. Now, these aren't all the signs and symptoms, however, they are considered the more mild ama characteristics, which we have the ability to somewhat control without needing to resort to medicines. Okay, let's go over our learning outcomes for the Agni and Ama education videos. We learned the functions of Agni, the importance of Agni, and the types of Agni. We learned about proper meal size and the different states of Agni. We're covering Ama and the formation process, learning the qualities and causes of Ama, signs and symptoms of Ama, and some tips to treat Ama at home. We'll see you in the next video.